Hey, my name's Alexis, and I'm going to be talking to you today about fluid volume deficiency, electrolytes, and the labs that go into fluid volume deficiency and how all of that kind of ties together. So what are electrolytes and their purpose? Electrolytes and body fluids are active chemicals. You have cations, and they carry the positive charges, and then the ions, and they carry the negative charges. So the major cations in the body fluids are sodium, potassium, calcium, and magnesium, and the hydrogen ions. And the major anions are chloride, bicarbonate, phosphate, sulfate, and protonate ions. And the functions of electrolytes include assisting in regulating of water balance, and then essential for neuromuscular activity and regulation of acid-based balances. So the 5 different labs that can indicate fluid volume deficiency are increased serum osmolality, increased hematocrit, and increased BUN level, increased serum sodium level, and an increased urine specific gravity. And then the expected reference ranges for the electrolytes that I had mentioned are sodium, potassium, magnesium, calcium, and phosphorus. Those are the ranges that we're going to look at today. So the expected reference range for sodium is going to be 135 to 145. The expected reference range for potassium is 3.5 to 5.0. Expected reference range for magnesium is 1.8 to 2.6. The expected reference range for calcium is 9 to 10.5. And the expected reference range for phosphorus is 3.0 to 4.5. The signs and symptoms for hypernatremia and hyponatremia. And now hypo and hypernatremia, that is sodium. So that's whenever your sodium is a little bit out of whack. So hypernatremia signs and symptoms, that's going to be whenever you have thirst, elevated blood pressure, swollen, dry tongue, sticky mucous membrane, hallucinations, lethargy, restlessness, irritability, simple partial tonic-clonic seizures, pulmonary edema, high pulse, high blood pressure, and then your labs might be a high serum sodium, a low urine sodium, high specific gravity, and osmolality. And that is for hypernatremia, so that's going to be a high sodium level. Now for hyponatremia, which is a low sodium level, you have anorexia, nausea and vomiting, headaches, lethargy, dizziness, confusion, muscle cramps, weakness, muscular twitching, seizures, dry skin, a high pulse, a low blood pressure. So hypo means low, hyponatremia, you're going to have a low blood pressure. So I just like all the hypo means low, that's how I remember the difference. And edema is also a sign and symptom of hyponatremia. And some labs that might indicate hyponatremia would be a low serum and urine sodium, and a low specific gravity and osmolality. So then signs and symptoms for hyperkalemia and hypokalemia, that's your potassium. So kalemia is potassium, and hyper once again is high, hypo is low. So your signs and symptoms for hyperkalemia might include muscle weakness, tachycardia, or bradycardia, which would lead to bradycardia later, dysrhythmias. Then you might have some prolonged PR intervals, QRS durations, absent P waves, maybe some ST depression. And for hypokalemia, you might have fatigue, anorexia, nausea and vomiting, muscle weakness. You might have on a CEG a flattened T wave, prominent U wave, ST depression, and prolonged PR intervals. So that might be for your potassium level if that's a little bit out of whack. Those are just signs and symptoms there. And then signs and symptoms for hypermagnesium and hypomagnesium, and obviously that is for your magnesium. So for hyper, you want to remember lethargic. So the L stands for lethargy. It's very profound and weak. The E is EKG. You're going to have changes in your PR and your QT intervals. They're prolonged in your QRS. It's complex and wide. Your T stands for tendon reflexes. They're either going to be absent or diminished. Your H is hypotension. A is arrhythmia. It's going to be bradycardia and heart blocks. R is respiratory arrest. G is GI issues. I is impaired breathing. And C is cardiac arrest. So if you can remember lethargic, acronym, then U will be set for your hypermagnesium signs and symptoms. Now, if you're looking at hypomagnesium, you want to remember twitching for your mnemonic, because the body is experiencing neuromuscular excitability. So T is for positive Trousseau sign because of the hypocalcemia, which is a low calcium level. The W is for a weak respirations. I is for irritability. The T is for abnormal heart rhythms, so the tetany seizures, but it's a Tourette D points, that's the abnormal heart rhythm, and then the tetany seizures. So you're going to have that with your T and twitching. Then C is cardiac changes. H is hypertension or hyperreflexia. I is involuntary movements. N is nausea. And G is GI issues. And you might have a decreased bowel sounds and mobility there. So when you're looking at hypernatremia, and this is going to be your sodium level, and hyponatremia, so once again your sodium, and this is nursing care and management for both of those. So once again, natremia is sodium. So when we're looking at sodium being out of whack, high and low, and you want to know your nursing care and management for hypernatremia, so high sodium levels, you don't want to restrict fluids. You want to dilute the patient with fluids. So you want to make the sodium decrease. You want to have your daily weights. You want to check I's and O's. And you want to do lab work because you want to keep an eye on that sodium level. If you have a sodium problem, you have a fluid problem. So you always want to remember that. If you have a sodium problem, there's a fluid problem. For hypo, the patient needs sodium because if you have low sodium, obviously you're missing something. You need to give them sodium. So if the patient has low sodium, give the patient sodium. So it does not need water. There are going to be neurological problems. So it could be hypertonic. You need to give them hypertonic NS, so it's going to be packed with particles. So you need that 3% normal saline, the 5% normal saline. That's what you need to be giving your patient for their IV. Then for hyper and hypokalemia, so potassium for the nursing care management. For low potassium, so hypokalemia, you want to give potassium because once again, if the patient doesn't have it and it's low, you want to make sure you're giving it to the patient so it regulates their potassium levels. So you want to give potassium. Also, you might need to give aldactone. It makes the patient retain potassium, and you need to eat more potassium. So potassium-rich foods, rich greeny vegetables, such as like spinach and greens and stuff like that. And then for high potassium, so hyperkalemia, you might need dialysis because the kidneys aren't working. It's the patient's retaining too much potassium. The kidneys might not be able to excrete as much potassium as needed, so they might need dialysis. Calcium gluconate, it decreased arrhythmias. Sodium, polystyrene, or other medications might be needed to kind of like insulin, because the insulin carries glucose and potassium into the cells, so that might be needed. You need to worry about hypokalemia and hypoglycemia whenever you're dealing with insulin, because the insulin can make the potassium low and the sugar low. So whenever you're dealing with insulin, you want to worry about low potassium and low sugar, obviously. Also, it's a major problem with potassium whenever you're taking it oral, so it could make the stomach's patient upset, so you want to make sure you give it with food. Also, you want to make sure that you never ever give IV push. You never want to give potassium push. You only give potassium through an IV. You do not ever give it IV potassium push. Don't ever do that. You mix it well, and then it burns during the infusion, so you can give lidocaine to maybe decrease that infusion. But never ever give an IV push. That's very bad, and it could be very deadly to your patient. The nursing care and management for hypernatremia magnesium and hypomagnesium. So if your magnesium is out of whack, it would be for hypomagnesium. You want to monitor the cardiac EKG changes, GI, respiratory, and neuro changes. And then your doctor might order some oral potassium supplements, and you want to take that with vitamin D or 10% calcium gluconate. You might want to administer some magnesium sulfate IV route, so the infusion. Monitor the magnesium levels very closely because it can cause them to send into hypermagnesium, and this can check deep tendon reflexes, diminish or absent reflexes. So you just want to check it very, very closely. You want to place them on seizure precautions. Oral magnesium may cause diarrhea, and this can lead to like more of waste of magnesium, so the patient could actually be losing more and more and more magnesium if they are taking oral magnesium, they have diarrhea, so you really want to keep an eye on that. Always get plenty of foods containing large amounts of magnesium. So they're going to include foods like avocados, green leafy vegetables, peanut butter, potatoes, oatmeal, fish like tuna, mackerel, cauliflower, chocolate, dark chocolate, legumes, oranges, milk, stuff like that, nuts. So you just want to make sure that you have those foods there. So for hypermagnesium, the nursing care management there, you want to just make sure that you really are watching everything, monitor cardiac, respiratory, GI, neuro. You want to place the patient on cardiac monitor for EKG changes. If the patient is not in renal failure or the patient's not in renal failure, you want to order diuretics. That way you don't waste magnesium. If they are in renal failure, then you need to prep for dialysis. And then IV calcium to reverse the side effects of magnesium. You need to watch for infiltration because it's hard on the tissues. And then a NG tube, if it's attached to a low intermittent suctioning, the nurse should monitor for hypernatremia, because the NG tube loses isotonic and it contains sodium. So that's what the nurse should monitor for. It should monitor the client for hyponatremia. So the sodium is going to be out of whack if it's placed on an NG tube because of the isotonic, the loss of isotonic, and that contains the sodium. So you just want to be on the lookout for hyponatremia if a patient is on an NG tube. All right, thank you.